All right, let's talk about something called obstructive sleep apnea, or OSA. It's a huge deal globally. And the go-to treatment? It's this thing called a CPAP machine. Helps you breathe while you sleep. But here's the mystery, and it's a big one. Why do so many people who desperately need this thing just stop using it? Let's get into it.
First off, let's just wrap our heads around the scale of this problem. We're talking about nearly 1 billion people worldwide affected by obstructive sleep apnea. I mean, just let that number sink in. That's 1 billion people whose health, whose quality of life is on the line. It's a massive public health crisis, no question about it.
And this is where we hit the big paradox. On one side, you have the promise, right? CPAP is, without a doubt, the best treatment we've got for this. It works. But on the other side, you have the reality. A huge number of patients just can't stick with it. They stop. So what gives? That's the puzzle we're going to try to solve in this explainer.
Okay, so if you ask most people, hey, why is CPAP so hard to use? You're going to hear the same old answers. They're so common, in fact, that we can pretty much call them the usual suspects.
And you've probably heard these before, right? The mask leaks, it irritates your skin, you get a dry throat or a stuffy nose, the machine makes noise, some people feel claustrophobic. And then there's all the practical stuff, the cost, dealing with insurance, what happens if the power goes out. For the longest time, we all kind of thought, yep, that's it. That's the whole story.
But what if that's not the whole story? Not even close. What if that list of usual suspects is just scratching the surface? What if the real reasons people give up are, well, deeper, more personal, and honestly, a lot weirder than anyone thought?
And this is where things get really interesting. A brand new study out of Turkey decided to dig deeper. They didn't just do a simple survey. No, they sat down and did in-depth interviews with people. They wanted to find the hidden reasons, the things other studies completely missed. And what they found? Well, it blew the usual suspects right out of the water.
So get this. Here's one of the first truly shocking things they found. This study was done in an area where earthquakes happen, and people were genuinely terrified that if an earthquake hit in the middle of the night, they wouldn't be able to get their mask off fast enough, that they'd be trapped by the very machine meant to help them. And it didn't stop with earthquakes. They found another fear tied to the environment: lightning. People were worried about having an electronic device literally strapped to their face during a thunderstorm. They saw it as a huge safety risk, and they figured it was better to just not use it at all than to take that chance. The researchers also uncovered these really powerful cultural factors that nobody was talking about. For example, during Ramadan, some Muslim patients would stop using their CPAP. Why? Because the machine has a humidifier to keep the air moist, and they were concerned that accidentally swallowing that water vapor could break their religious fast.
And then there was one that seems almost comically obvious once you hear it, but was totally overlooked. People with long hair or beards. They just couldn't get the mask to seal properly. You can't get a good seal, the therapy doesn't work. Simple as that. So, when you add all of this up, earthquakes, lightning, fasting, beards, what does it all mean? Well, the researchers themselves said it best. They said, our old ways of thinking are, and I'm quoting here, insufficient. Basically, just focusing on making a better mask or a quieter machine, it was never going to be enough. The problem is way more complex. We need a completely new way to think about it.
And that's exactly what this study did. It didn't just point out all these new, unexpected problems. It actually built a new model for a solution, a more complete framework for understanding what actually helps people stick with their treatment in the real world. So when they crunched all their data, two things jumped out as having an absolutely massive impact. First, having good access to healthcare. Things like decent insurance, being able to get an appointment, that made someone more than 3 times more likely to use their CPAP. But on the flip side, dealing with psychological issues like depression or anxiety, that dropped the chances of sticking with it by a whopping 71%. And you can see it so clearly here. The boost you get from good healthcare access is just huge. And that negative pull from psychological issues is incredibly powerful. What this really tells us is that maybe the biggest factors aren't about the machine at all. They're about the support systems, or lack thereof, surrounding the person. So, based on everything they found,
The researchers came up with something they call the multidimensional CPAP adherence model. It sounds complicated, but the idea is simple. It's like putting on a new pair of glasses. Instead of just seeing a patient with a machine, it forces us to see the whole person in the middle of their messy, complicated real life. And this new model breaks it all down into 5 key areas. You've got the individual stuff, like your overall health, or even, your hair. Then there are the psychosocial things, like does your family have your back? Of course, the technology still matters, the mask fit, the noise. But here's the game changer. The model officially adds in those environmental factors, like the fear of earthquakes, and the cultural ones, like religious beliefs. It's the first time we have a model that puts it all together. Okay, so why does any of this matter? What's the big takeaway? Well, the implications here are pretty profound. This isn't just about building a better CPAP machine anymore. It's about creating a fundamentally better way of taking care of people.
Here's takeaway number 1. Focusing only on the tech is a dead end. It's not enough. We could engineer the most comfortable, whisper-quiet, perfect-fitting mask in the history of the world, and a lot of people would still struggle to use it.
Why? Because at the end of the day, helping someone stick with a treatment isn't about the hardware. It's about understanding their life, their whole life. It's about taking their culture seriously, taking their environment seriously, and yes, taking their fears, even the ones that sound strange to us, seriously.
And that really leaves us with a huge question, one that goes way beyond just CPAP machines. This is about healthcare, period. How do we get better at this? How do we stop treating people like a list of symptoms to be checked off and start designing care that's actually flexible enough, empathetic enough, and smart enough to fit into the beautiful, messy, complicated reality of a human life?